Hi, welcome back. Well, today I have a rather onerous task, and that is to introduce Dr. Alan Gaby. Now, I could go through a long list of all his professional credentials. I'll just mention a few. But if I was to do all that, it would take a long time, for one. And two, I'd probably be too overwhelmed and continue and give you my personal opinion. So I'm opting out of that process. I will tell you this about Dr. Gaby. A few things. One is he was a professor of mine at med school back at Bastyr University in the late 1990s, from 95 to 98. That's when I graduated. He is a MD, a medical doctor. And what differentiates him from pretty much any other doc, for the most part, is that he graduated from Yale as an undergrad. That's not the unique part. He then went to Emory to get a master's in biochemistry. And after that, he went into medicine. He went to med school. So that put him at an entirely different place to view medicine. So think of the mind that was going through all the tedium of all the ologies you have to remember and go through. But when it got to therapeutic treatment side of med school, he was thinking about biochemistry. Nobody was thinking about biochemistry back in the 80s, I was believed. And so he was so far ahead, he had few people to talk to in that sense. He teamed up with Dr. Wright at the Tacoma Clinic in Tacoma, Washington, and practiced there for nearly 2 decades, 19 years. That's basically where I met him, because he also decided to teach at Bastyr Nutritional Medicine. Well, looking back on all of his experience, that he was doggedly determined to reference any particular substance, we'll call them supplements at this point, that he could use in his patients, whether they're intravenous, IV therapy, or oral. And his work week was, as I understand it, was 3 days of practicing and seeing patients, and the rest of the week for referencing and going to the library and photocopying. Well, how tedious. Now you can get most of that, or a lot of that, online. So it was a whole different era in terms of labor to put into it. So he continues now to read a little more efficiently 600 journal articles a month. So why do I mention this? It's because we are living in an age of, I think it's a high watermark of fake information in terms of marketing. Very clever. It's the internet primarily. And so how do we know as an individual if something is true or not? It sounds good. They know how to present it, right? They get professional marketers to make it look really authentic. But how do you know the reference for this? Well, he in 2017 put together the first edition of Nutritional Medicine. All his experience, all the articles, all the research that he had looked into up to that point. It's now been a second edition, and a third edition I hear is coming out as well. Let me show you what this looks like. It's a nearly 9-pound book, over 1,400 pages long. And it's not just for every physician that's out there. It's now used in 37 different medical schools internationally. It should be on every physician's desk. It's getting there. It's getting there. But really, I believe it's the layman, it's the health practitioner, or the person that really wants to sort of say, I heard this claim, is it true? He will show you, or he has, through his research, put all the different conditions that he's ever worked on and researched, as well as looking into supplements individually. So you got it both ways. That's phenomenal. That's phenomenal. It's such a tome of well-researched and experienced information that anybody can access this. And he has subsequently been called the father of nutritional medicine. He, of course, will deny that and say, well, he was influenced by people like Linus Pauling. He was influenced by Abram Hoffer. He's influenced by Roger Williams. Look these names up. And true, those are the shoulders that he stood on. But he brought it to such a level far beyond any physician in this country. And he and Dr. Wright, in fact, had a seminar for a number of years. It lasted 4 days long. 4 days long. They would travel around the country and present all that they knew, from conditions to how to treat these conditions, from what they knew, not speculative, but from the research. And so as their series of nutritional medical conference talks expanded, you would get this loose leaf notebook of all the conditions and how to treat them. Then you'd get a separate book that had, much like the nutritional therapy, nutritional medicine textbook that he's written, and you'd watch it grow over the years, get thicker and thicker and thicker. And so it is that work that is the accumulation. It's a singular reference. It's definitive in every aspect, and I believe it's absolutely the tool that you can use, anybody can use, to sort of say, I'm not quite sure, what kind of magnesium should I use? What's the research on that thing? What's the research on vitamin C? What's the research on vitamin D? What's the research on? So instead of just going from claim to claim to claim that you heard either by somebody's email they sent you or some YouTube presentation, I'll end there. He has always been the voice in the back of my head, for better for worse, since I graduated in 1998. And I've often thought, when I come to a new idea, what would Dr. Gaby think? I call him Alan. So what would Alan think? And so finally I got to cash in on that, to ask some questions. And I hope it will be an open door to future interviews with Dr. Gaby as well, because they all lead to, of course, another question, another topic, another appointment, and another interview. So with no further ado, today what we're going to talk about is nutritional medicine, that is, things you can use for COVID. You've heard this covered probably a lot, but you haven't heard it covered by what actually works, what people have seen. So we're going to start there, and we're going to have subsequent videos of different topics that we'll present later. Okay? Enjoy. Bye-bye. Thanks, Alan, for taking the time to do this. Let's start off with the top. You are probably a person that people ask about, what should I do about COVID? Where is nutritional therapy relative to COVID?
Well, I wish we had more research. There's so many things being studied, and there's not a lot of funding behind nutrition research because you can't patent them. So you have to base a lot of the decisions on what we know from other research on how to prevent and treat other infections. But there is actually some research on using vitamin D and zinc and vitamin C for the treatment of COVID. So basically a general program I would start out with is basic nutritional improvements. Mm-hmm. Try to cut as much of the sugar out of your diet as you can. Sugar depletes immune function in many different ways. It also has effects that are known risk factors for bad outcomes in COVID. It raises blood pressure. It causes insulin resistance and possibly diabetes. It causes obesity. It raises the blood levels of cortisol, which is the adrenal hormone that suppresses immune function. So there's nothing good about sugar in relation to COVID. And you can't prove that eliminating it is going to have you have a better outcome, but it has so many other health benefits. It's kind of a, what have you got to lose, except maybe going through addiction withdrawal for a few days. The other area that I look at, and this would require, it would require working with a healthcare practitioner who knows about this, is to look for hidden food allergies. I'm not talking about the kind where you eat peanuts and your throat swells up. I'm talking about what many people in the integrative and naturopathic medical fields call masked allergy, where people are not aware that it exists, but it's a contributing factor to many different chronic problems, from arthritis to migraine headaches to fatigue, depression, and many other things. And what we do is an elimination diet followed by individual food challenges to identify the hidden allergens, to see what is contributing to our chronic symptoms. And if you do that, in my experience, many people who identified their allergens and got them out of their diet told me that they had a lot fewer and less severe infections going forward, as long as they avoided those foods. So those are the two main dietary changes that I would recommend. As far as supplements, Vitamin C has many different effects on immune function. We know that it reduces the duration of colds by about 30%, and practitioners who use high-dose vitamin C, including intravenous vitamin C, have had dramatic responses in patients with infections. Two patients that I remember come to mind. One of them had pneumonia. It was viral pneumonia. She was a woman in her late 50s. She came in for her first visit with a 3-week history of viral pneumonia, and I hooked her up to a 50,000 milligram, 50-gram infusion of vitamin C. That's a lot. And I infused it over 3 hours. 90 minutes into the infusion, she became symptom-free, and it didn't come back. So this was a 3-week history of viral pneumonia that was cured in an hour and a half with a massive intravenous dose of vitamin C. Same kind of results with a young man who had mono. He was well within 48 hours. Typically, it takes many, many weeks or even months for people to get well. So there's a study out of China where they gave 12 grams intravenously every 12 hours for, I think it was 4 days, might have been 7 days. And there was about a 33% reduction in mortality. And if you look at only the sickest people, there was close to a 60% reduction in mortality. So those of you who have access to intravenous vitamin C, they won't do it in the hospital typically, but there are a lot of practitioners who will. That might be useful, but we also use oral vitamin C to what we call bowel tolerance. And again, this should be monitored by a practitioner so you know what to watch out for in terms of adverse effects. But basically, you take as much as you can until you get diarrhea, and then you cut it back. You take it in divided doses, three to 6 doses per day. Vitamin D is another thing I would look at, and we'll talk more about the controversies about that later, I guess. There's a study from France where they gave a certain metabolite of vitamin D. It's called 25-hydroxyvitamin D. It occurs naturally in the body. The body converts vitamin D into this compound, and it's sold as a prescription drug. In this country, you'd have to take 17 pills, and it would cost $1,200. The product is called calcifediol, Calcifediol, and it is approved for one particular indication, people with an elevated parathyroid concentration who have kidney disease. So this is what the drug is approved for, but it's a vitamin D analog or vitamin D metabolite, and they gave it to people who were hospitalized with COVID. And the percentage of people in the placebo group that had to go to the intensive care unit, the ICU, 50%. In the group that got calcifediol, only 2% had to go to the ICU. This is about the most dramatic benefit you will ever see in a clinical trial. There was another one that came out, actually that previous study was in Spain. I correct myself. The one I'm talking about now was in France. This was where they looked at nursing home patients, and those who got vitamin D had substantially lower mortality than those who did not get vitamin D, again, with COVID. Finally, a study came out. It was from Brazil, and it was published only a couple weeks ago in the Journal of the American Medical Association. And in this study, there was absolutely no benefit from vitamin D. The main difference between that study and the ones that was positive was in the negative study, they gave an enormous single-time dose. They gave 200,000 units one time, and then they followed them and saw how long it took them to get better. From previous research using vitamin D for other purposes, it appears that using single massive doses is not the best way, and it might actually there's a therapeutic window, which means once you give too much, you start to lose some of the benefit. So I can't prove that, but that's possibly what happened, that they gave too much at one time. So if I had COVID, I probably would take 10,000 units the first day, do that maybe for a week, and then cut it down to maybe 4,000. But again, with medical supervision, there are potential adverse effects of high dose vitamin D. The last thing I would look at, well, there's always things after the last one, but zinc. Zinc is known to prevent COVID from entering cells, and they used it in combination with hydroxychloroquine. I know the research there is controversial, but a lot of docs out there think this combination gives a lot better outcomes. We know that zinc has a direct antiviral effect against a number of different viruses. We also know that zinc, when given in the form of lozenges, reduces the duration of the common cold by about 40 to 50%. My opinion is that if we were to use zinc, we should probably use it as lozenges, because the direct release of zinc ions in the mouth may help prevent the COVID viruses from getting into the lung tissue, because it's directly right there, rather than taking it as a pill, having to get absorbed into the bloodstream, then go back to the site of the infection. So those are the three main things I would do. The final one would be black elderberry, also known as Sambucus nigra. Black elderberry syrup has a long history of traditional use for respiratory infections. And there was a meta-analysis, which is where they combined the results of a bunch of different studies. And they looked at 4 studies and they combined it, and they found that there was a marked benefit, reduction of symptoms in people who had colds or flu. Now, that's not COVID, but there is some evidence, it's kind of circumstantial. There's a virus in chickens that causes it's a coronavirus, and it causes what they call infectious bronchitis. So that's the closest thing in research related to the human coronavirus. But in the test tube, black elderberry extract inhibited the replication of this chicken coronavirus. So it would seem reasonable that we would use this at the first sign of the infection. Some people have argued that it might be dangerous to use black elderberry because there was a study where it increased the release of cytokines. Many of you have heard of the so-called cytokine storm, which is the massive inflammatory response that occurs in people with late-stage COVID. And the body's reaction, the inflammatory response, is what causes the deaths and the severe respiratory problems rather than the virus itself. But the study where black elderberry increased cytokine release was done in a test tube with the white blood cells of healthy volunteers. So how that might relate to a person with an infection is entirely unclear. The only other study where they looked at cytokine release in relation to Sambucus was in animals, where they gave it to them orally, and it actually decreased cytokine release. So that's all the information we've got. And based on that minimal evidence and my personal experience with it has been very good. My son had the flu when he was 9 years old. He had the swine flu. It was 11 years ago. And everybody in his class got it. They were all home for 2 weeks. And he came out with the same symptoms, identical. We put him on Sambucus. It was a proprietary product that was one of the few available at the time, called Sambucol. We gave him a tablespoon every hour while he was awake. He was well within 30 hours, compared with 2 weeks for the rest of his class. So I know that's an anecdote, and we're not supposed to rely heavily on that, but I was really quite impressed with that. So based on the research and my own experience with him and other people, I probably would hit the body really hard with Sambucus early on. If somebody was in the late stages, based on the theoretical possibility of an adverse effect, I probably wouldn't use it when somebody had an advanced disease. So that's a not so brief summary of the kind of things I would look at.
Excellent. Excellent. You know, one thing about elderberry, I remember from Bill Mitchell in school, is that he would talk about, if you used any berry, and it hasn't been done commercially, if you freeze it first and then make your subsequent tincture or whatever, you've broken the cell wall, and therefore you get more of the contents. It's just an interesting aside, but I've written it all down. Thank you for that. That's a big deal, by the way. You know, we're still, some people aren't thinking that COVID is anything anymore. Some people are terrified by it. And then we hear the next wave of the new thing that came in. It's like people are very confused. So I really appreciate that a lot. All right, well, let's go into vitamin D, since that was part of it. Hi, this is Dr. Goldkamp, and I just wanted to insert a little errata, that is a correction of things that I had mentioned in the video about Dr. Gaby that were either vague or untrue, and this actually comes from Ellen specifically. So let's start with the top. When I referenced that Dr. Gaby reads 600 articles per month, the correction is actually he goes through the table of contents of 600 medical journals, looking for relevant articles to cull through and do other types of literature searches as well. There's no way he could have read 600 journal articles per month. The second thing, the first edition of the Nutritional Medicine was not published in 2017. It was published in 2011. The second edition was published in 2017. That's the one I have. And there's a third one coming out, he tells me, third edition. Also, when I referenced 37 medical schools used his book, he responded with, actually, the book is being used in 37 countries. And by his account, 30 different graduate and undergraduate nutrition programs. But in general, the medical schools, other than naturopathic medical schools, have not jumped on board. And this is a really important point, and I'm sorry that I did not make a strong enough emphasis on this. The schism, the rift, the separation between conventional medicine, unwilling to look at natural solutions, cheaper natural solutions, more effective natural solutions, is absurd. It is just too much of a adherence to the pharmaceutical companies. Enough on that. When I mentioned Dr. Wright's Tacoma Clinic in Tacoma, Washington, that it is called the Tacoma Clinic, but it is not in Tacoma, Washington. It's actually in surrounding towns to Seattle, Washington. Finally, in his presentation, when Alan talked about the study of IV vitamin C from China, he did not specify that it was a study of COVID patients. Prior to that, we were discussing, as you just saw, was the application of vitamin C about treatment for infections in general. And then he moved on to the China study without making it clear that it was COVID patients. So it was about COVID patients from an IV vitamin C study. Amazing. So that's it. Till next time. Bye-bye.